Hello, welcome to Health Talk with Dr. Toyin. Today we'll be discussing anxiety. But before I move on, if you have not yet subscribed to this channel, please pause this video and click on the subscribe button below. You'll be informed of new videos and other videos in the series. Welcome back. October 10th is World Mental Health Day, and we'll be discussing anxiety today. Anxiety on its own can be a normal reaction to a stressful or unusual event, which is what is known as fight or fright response. When anxiety becomes a problem is when there is an excessively severe or prolonged reaction, especially when there is no predisposing stressor to this event. It also causes the individual social, physical, and occupational distress due to this episode. It has been said that in a population at any given time, about 5% will suffer from anxiety. Some societies, there's an estimated lifetime risk of 25% of individuals getting anxiety at one time in their lives. There are some things that make you predisposed to anxiety. One would be age. Adolescents and older age people tend to have anxiety more. Secondly, the sex. Females are 1.5 to 2.5 times more likely to have anxiety than males. Third, some with prolonged or stressful medical conditions like arthritis can predispose one to anxiety. Fourth, it has been said that some individuals are just prone to getting anxiety, and this has been seen from early childhood where they are timid or insecure. Also, there are some stressors that happen in childhood, like bullying or peer victimization. Also, some parenting skills that are overly harsh or protective can also predispose one to anxiety. When there's a family history of mental health problems, one can be predisposed to anxiety. There's some environmental factors like unemployment and low socio-economic background that can also predispose one to anxiety. What are the clinical features of anxiety? They include things like tension, difficulty concentrating, a reduced libido or impotence, and also physical factors like an excessively fast heartbeat or an awareness of the heart beating fast, which is called palpitations. Also, the individual might be sweaty, have a dry mouth, or have diarrhea. A questionnaire called the GAD-7 can be used to assess the level of anxiety in an individual. What are the conditions that can mimic anxiety? One would be excessive caffeine intake. Two would be hypothyroidism, which is an excess of thyroid hormones in the body. Three would be hypoglycemia, which is low blood sugar. And four, drug and alcohol withdrawal. So what's the treatment for anxiety? There's something called cognitive behavioral therapy, which can be used, and the individual is taken through some psychological methods to help deal with the anxiety. Also, some medications called selective serotonin reuptake inhibitors, for example, sertraline, can be used for this condition. Also, tricyclic antidepressants can also be used for this condition. I would advise, if you notice this, please seek medical advice and don't try to deal with it by yourself. I hope you enjoyed this teaching. Don't forget to subscribe, watch again, share this video, and until next time, smile because it's healthy. Bye.